Welcome to the Obesity Medicine Podcast with your host, Dr. Matea Rentia, board certified in internal medicine and obesity medicine. Here, we talk about a path to metabolic health, and we have real conversations about chronic weight management and living a full life. Just a reminder, I am a physician, but I'm not your physician. So everything that's on this podcast is for informational purposes, but please go talk to your doctor about what's right for you. There is no medical advice being given on this podcast. Welcome back to another episode of the podcast. Friends, I have a real treat for you because I've brought back, I don't know, is this like the fourth, the fifth, the sixth time that
I think
it's a
probably
lot.
the third, actually,
The
but
third, it feels more. It feels
we
more.
talk a lot, though. We talk a lot. So.
Exactly.
It's always a podcast when we're together.
Exactly. I have brought back Dr. Komal Patil-Sisodia. She is a triple board certified endocrinologist, does a lot in the metabolic health space. And today we're going to talk about the hormonal aspect of hair loss. And so I was wondering if you can just start out introducing yourself because we have new listeners all the time. And also, let me not forget, can you tell us about your podcast as well, just right from the jump, because I love it. Okay.
Oh, thank you. Yes. So thank you again for having me. I love being on your I just love talking to you because we always have like so many ideas we're exchanging. But for all of the listeners who have not heard from me before, I'm Dr. Komal Patil-Sisodia. I'm a board certified endocrinologist, internist, obesity medicine specialist, and a Menopause Society certified practitioner. Mouthful. But I am very passionate about endocrinology, metabolic health, women's health, and I have a podcast called Clearly Hormonal. I have a practice in Redmond, Washington called Eastside Menopause and Metabolism. And I am just super excited to be here. I love what I do. So, yes. And hair loss is very personal to me because I have had several hair loss journeys starting from when I was in college to different periods in my life. And because it's been so personal to me, and I was listening to your podcast episode last week where you were talking about it and the association with weight loss, I've always been looking at what I can do from an endocrine perspective and then experimenting with all the things that are out there on the market. You name it, I've probably tried it.
Thank you for sharing your experience. I don't know if you know this, but we did a conference however long ago here, like, I don't know, a year or two. I can't remember at this point. And you were talking about your hair journey. And I was like, and then to myself, I was like, oh, Matea, you need to go see a doctor. Like, there are answers, there are things. And I was like, it's because we were talking about it, right? So it always shows to me, it had been niggling in the back of my mind for a long time, but I was like, I don't want to do anything. I don't want to take anything. I was very I don't know, like in denial. I don't know what else to say. I just didn't want to address it. And so when you were talking about it, I was like, oh, okay, I should look into this.
Well, and denial is a big part of it. Denial comes in strong because you don't want to acknowledge that there might be something wrong.
Yeah.
And the other thing is that as women, our identity is so tied to our hair.
Yeah.
And every time it's happened to me, I've been in denial. The first time I had hair loss was when I was, I think, end of college, starting med school. And it was just a really stressful time. I think I was going through some personal stuff. There was a breakup in there, and then it was the stress of starting medical school. And I came home from summer break and I think I'd lost a third of the hair on my head. And my mom, my sweet Indian mother, looked at me and goes, "Oh my God, who is going to marry you?"
Oh,
And I was like, "What?" Like, that's the reaction.
oh
Like,
my gosh.
And, like, understandable. Immigrant parents, anybody who's listening to this, they have certain goals for their kids, which are like, you're going to get a good education, you're going to get a good job and be financially independent, and then you're going to get married and have grandbabies for me. Those are the three expectations of all immigrant parents for their children, right? So I was like working on the first two. The third one was in jeopardy, though. She was like, "Oh no, we must fix this." So that 4 6 week period, I was home. I got dragged to her Eastern European hairdresser who gave me all sorts of concoctions to put on my scalp. Like, I was being force fed protein. At one point, she took me to our family doctor who's known us for years. And the funny thing is, I practiced at the same place as him, like the same hospital system later. And I was just like, "Thank you for dealing with me and my family's special level of crazy, right? Because I also had a doctor's appointment at this point. She takes me to the doctor and she's like, Dr. Chia will know what to do, right? And I was like, okay. So I was like, Mom, I need you to stay in the waiting room. And I'm going to go talk to Dr. Chia because I'm in my 20s at this point. Like, I don't need my mom to come with me. And I'm sitting there, he's talking to me. We're talking about med school, touching on the hair loss. He's like trying to get to the room. And my mom bursts into the room. It could have been like a sitcom. And she goes, Dr. Chia, fix her hair. Nobody will marry her. And I was like, damn, this is the recurring theme. Nobody's going to marry me with my hair loss.
That's so funny that she came back. It's
Oh,
like,
she
I don't know
totally
if they would
did.
allow that nowadays.
I don't think they would have. This was like early 2000s, and you have to, like, a smaller town. We'd gotten our healthcare in this particular clinic for a long time. It had been at least a decade at this point. So they all knew her and they let her back. And that's what it was. It was like a very, I should write that in a sitcom episode type scenario.
That
And Dr. Chia just looked at me. He goes, just eat more protein and work on your stress. And I was like, okay,
You're like,
cool.
thank you.
Yeah.
Okay, you said there were other times as well, or kind of
Yeah.
leading into now. What did you discover over time with yourself?
So I think one of the things, and I've done a lot of content recently on PCOS or
Yeah.
PMOS now.
Yes.
For those who are listening, PCOS, polycystic ovarian syndrome, the name has been changed to polyendocrine metabolic ovarian syndrome, which is just a little bit more of a mouthful, but a little bit more accurate descriptor. One of the things that I've realized looking back was I probably started to have symptoms then. And that first round of hair loss that we attributed to stress was also probably the first signs of PMOS that I was having because I had already had like the heavy periods and the increased facial hair and things. And I'd written that off because I'm like, I'm Indian, Indian
Yeah.
women have hair. It's fine,
Yeah.
right? So I think what we don't do is we don't do a good job of teaching women how to pay attention to their bodies when these things are happening.
Yeah.
Because I wrote the first one off to stress. I wrote the second one off to postpartum. And then maybe 5, 6 years ago, I wasn't even stressed yet because the pandemic hadn't started yet. It was 2 weeks later, the pandemic started, and I was having a flare of this rash that I thought was eczema for years. Turns out it was psoriasis, but I went in to see my dermatologist, and I love her. She is such a wonderful person. She's a friend, but her delivery is very deadpan and very direct. So we're sitting there and we talk about the rash, whatever else, and I'm getting ready to leave, and she's like, "Are we going to talk about the fact that you're balding?" And I was like, "Damn, girl." I know we're friends, but
These
like,
are some direct conversations that you were
and
having.
right. And I appreciated it. Her MA was like, I'm working on it. I'm working on her delivery. We're working on her soft skills. But I was so grateful because at
Yeah.
that point, it really forced me to look at the fact that I had signs of androgenetic alopecia. And
Yeah.
she sat with me and she was just very logically walked me through it. Okay, so you had all your labs checked, they look okay. And at that point, I think my PMOS symptoms had been pretty well controlled. I didn't have elevated androgen levels that they could catch on labs. All of that was really good. Didn't have signs of insulin resistance. But she was like, look at the scalps of the women in your family as they age. Do they have thinning hair? And I was like, yes, they do. And she's like, so there is a genetic female pattern hair loss that you're also dealing with. So I've been through the gamut of it. I've been through stress, I've been through postpartum, I've been through PMOS related hair loss, and then the realization that we have female pattern hair loss that runs in our family, and that I had to be proactive about it because I'd gotten lucky so far that it had come back each time. And I
Yeah.
wasn't going to keep getting lucky if I didn't do something about it. That kind of sent me down the rabbit hole of trying to figure out all of those things. So,
Thank you for sharing all of this because, again, I
yeah.
think the context, there's so much that I can relate to here, these different periods that you're talking
Yeah.
about. It's so incredible how the stories are so similar for many of us. Can you give us a little bit of a broader context? What are some of the endocrine factors that can play
Yeah.
into hair loss?
Yeah. Well, so the first one I mentioned, which is the polyendocrine metabolic ovarian syndrome, that one we very commonly will see androgenetic alopecia or androgenic alopecia, where you have that frontal hair loss on your scalp, but then increased facial and body hair everywhere else. And that tends to be a pattern. That's because of those elevated androgen levels, testosterone, DHEAS. The flip side of that is that you can also have that by itself. If there's an ovarian or an adrenal tumor that is producing testosterone or DHEAS, you can have similar symptoms without actually having PMOS. So there can be ovarian or adrenal issues that happen there. There are other things like thyroid disease, hypothyroidism, and hyperthyroidism. So if your thyroid gland is underactive or overactive, it affects the health of your hair follicles. In hypothyroidism, because you have less thyroid hormone on board, and that's what regulates your metabolism, you actually get hair loss. But one of the hallmark features is you lose potentially the outer third of your eyebrows and eyelashes. I have women coming and telling me, I'm losing my eyebrows, I'm losing my scalp hair. We joke in endocrinology, you're not a real endocrinologist until somebody brings you a bag of their hair to show you how much they've lost to try and prove to you that they might have a thyroid issue. It's like a rite of passage. And I totally understand it because I've done it. I've not taken the bag of hair in, but I've tracked my hair loss in my hairbrush or how much is clogging the drain. And it's really
Yeah.
hard not to freak out when you see that amount of hair coming out, right?
Yeah.
Because the true thing that I've found over the years is that you lose hair a lot faster than you can grow it back.
Yeah.
Ask me how I know from personal experience, right? It takes a while. And for my patients who have thyroid disease with the low thyroid hormone, they're losing the hair on their scalp, they're losing body hair, they're losing outer third of the eyebrows, they're getting brittle nails that are cracking.
Mm.
On the flip side, when you're hyperthyroid, because you're hypermetabolic and your body needs to fuel its metabolism, you're also then starting to lose hair because it can't maintain the hair on your head as well. So people are like, well, I can't win if I have either thyroid condition. And the truth is, yes, those are the two major things that can happen. And then the other place that I see it is when people get Cushing syndrome. Cushing syndrome is where your pituitary gland in your brain, that's actually Cushing's disease, has a tumor that's overproducing the hormone that stimulates your adrenal glands to make cortisol. The end result is you have high cortisol, but it's because the brain is sending ACTH, which is that hormone that stimulates the adrenals. Or if there's an adrenal growth that is overproducing cortisol, it as a tendency also tends to overproduce a little bit of DHEAS. And what I'll see in my patients with Cushing's is they will actually get like a fine peach fuzz on their face, but then they'll start losing their scalp hair. So
Yeah.
there's a lot of different flavors of it, but the really important thing is understanding your stressors, like what may have contributed leading up to it. I know we see in our weight management patients that the weight loss and the calorie restriction that can also really contribute. But then also, what are the other physical signs and symptoms on your body that you need to look for to know for a fact? And then my other subset of patients who have very heavy periods, whether that is from PMOS or from something like endometriosis, with all of that blood loss, they lose a lot of iron, and that iron deficiency, even though it's not a true endocrine, like directly endocrine, that iron makes a big difference.
I love how you pulled that back because it's
Yeah.
people don't fully walk the dog all the way on it.
Yeah.
So hair loss is
Yeah.
happening in your clinic. Are there
Yeah.
certain labs that you're always ordering?
Oh, absolutely. First, I sit and I talk with the patient. Like I said, I try and get an idea of what are the stressors, how long has the hair loss been happening, are there any other symptoms that are accompanying it, and then we go from there. But generally, I will always screen TSH with reflex to free T4, and it's not standard of care to do this, but I do this because I'm a type A endocrinologist. I'll check a set of thyroid antibodies, TPO antibodies specifically, to look for Hashimoto's because for whatever reason, my Hashimoto's patients, in my experience, I don't know that there's actually data in the literature to back this up. They tend to have worse hair loss. I don't know why.
Yeah, interesting.
So I will look for all of the thyroid studies. I will look and see if there are signs of hyperandrogenism. I will always check a testosterone and a DHEAS fasting in the morning to see what those look like. If I am seeing signs of Cushing syndrome, which is very specific, you get weight gain all through the trunk, you get muscle wasting in the arms and legs, and you have that pattern of soft peach fuzz and scalp hair loss. If I'm seeing that, then I'm going to screen for that, right? Because that's usually also accompanied by diabetes that's kicking up, things like that. And then with nutrient deficiencies, especially since I see some patients who are post-gastric bypass or they have some sort of malabsorptive thing, and the heavy periods, the iron is going to be a big thing. So iron studies. Then I will check vitamin D because there's really great data that shows that low vitamin D can be associated with hair loss. And then I've found that B12 also is a contributing factor, especially I have some patients, and this is not very common. I have one or two in my practice who have a condition called pernicious anemia, which is an autoimmune thing where you just don't absorb the B12. And so I have them nasal spray B12, which works wonderfully. But that low B12 can do that. Or if you have a patient who's vegan or vegetarian, they may not be getting enough B12. Or if they're on metformin for a very long period of
Yeah.
time, metformin will deplete that B12, right? So I'm always looking for these little patterns, but those are really the main things that I try and rule out off the bat to know that are we looking at all the potential medical things, hormonal medical things that are going to contribute to your hair loss?
Okay, this is a super comprehensive list. I'm so glad we went through this. And
Yeah.
I want to double back to you were talking about looking for hyperandrogenic
Yeah.
manifestations on the body. I know you said a few of them. Can you name a few of them just so people know?
Absolutely. So it'll be a pattern of scalp hair loss. So you'll see thinning across the crown, right? You will see increased facial hair, like those coarse, what they call terminal hairs, like the thick ones. You'll see that on the chin, neck, potentially. Some women have it on the chest and around their nipples. You'll see increased hair growth in the groin area, spreading onto the thighs and up the stomach, and
Mhm.
then increased just body hair in general. That can be a sign. The other sign can be changes in the voice. If your voice is getting deeper, it can be a sign that you have excess testosterone. It's really interesting because the voice literally changes octaves. And the sad thing is when it gets to that point, even if you treat the underlying condition, like say you find a testosterone producing tumor, the voice doesn't go back. So at
Ah.
the first sign of those things, I'm always asking questions. And then some patients report clitoromegaly, which is another sign of having too much testosterone on board. They have enlargement of the clitoris, and that can be painful or disturbing or very psychologically distressing to people when they see
Mhm.
changes like that in their body. We also see an increase in muscle mass, right? Because there's more testosterone, so you're holding on to muscle a little bit more, but that doesn't happen in everybody. But that's the general pattern that I'm looking for when I'm seeing somebody with high testosterone or that I
Mhm.
suspect has high testosterone.
What? And I'm jumping around a little bit just because I had some
Yeah.
questions as we were going through. With the thyroid, if you treat those
Yeah.
conditions, either hyper or hypo, does the hair and the eyebrows and eyelashes, stuff like that, does that come back or is that continue to be?
It usually does, but again, going back to what I said before, we lose it so much faster than we can grow it back. My friend who's my dermatologist, she was like, one hair follicle lives for 3 months. You have to go through two hair follicle cycles to even see the little baby hair sprout out. Then really it's going to be a year before it comes back. And I think the thing that people have the hardest time with is that duration of time where they are left feeling like they don't have a solution. And it also causes a lot of people to give up on stuff. They will
That's
try
what
something.
A
Yes.
100% because and I don't know how far we'll go on this episode
Yeah,
because
yeah.
guys, we could talk for 10 hours, but I feel like I've tried some different products and I know I'm not using them long enough. Like
Yeah.
fact, I past 3, 4 months, I'm like, I don't know. Do I want to spend 200, 300 again? It's like it just feels
I
like,
know.
am I getting had here? But and then I don't think that enough of us keep good records because I don't know about you. I cannot
No,
remember when I started things. So now
no.
I'm getting a little bit better. Everyone, this is my tip for you. I have in my phone one note and it tracks my weights. It tracks, I don't know if I am tracking blood pressure, whatever it is, I
Yeah.
have it all in one document. So
See, that's brilliant. I do the peck and hunt and I look at my email to see when I ordered said supplement
that's
and try
so
and backwards
good.
extrapolate how I did, how long I've taken it, which is not useful. So yes, do Mateo's note method. I might have to start that today because like, oh, it feels like I did this for 3 months, but
Totally.
even that's not enough. Truly, you have to do something for 6 months to a year for it to be able to help. And there are so many different treatments that are out. Well, not so many. There are different treatments out there, but if you're not giving them their full due, that
You don't
you
find
don't
out.
actually know. Right.
We talk about lots of
Yeah.
conditions here, lots of reasons.
Yeah.
Let's assume that there is this androgenic pattern
Yeah.
happening. So this female pattern hair loss, again, all the things that you're talking about.
Mhm.
What can be done about that condition
Yeah.
specifically?
Yeah, and I think that that's a great question. First and foremost, if you are suspecting that there is a tumor that's producing it, because that presentation is much more dramatic, it
That's what I
will
was going to
really,
ask. That's
yeah,
like sudden onset. I mean, you're
it's
not
very
going to,
sudden.
yeah.
Yeah, it may not be sudden onset, but the presentation is dramatic, right? Like the
Okay.
facial hair is like a male beard.
Oh, okay.
Yeah,
Mhm.
there is truly so much thinning on top that you can see scalp. There is that deepening of the voice that you will notice right away when you're starting to talk to somebody. You can kind of see more of their muscle definition. They may have more acne. For
Mhm.
those patients, the ones that I strongly suspect, I will do that workup to look at the ovaries and the adrenals, and we'll figure out what that looks like. And then if that's all ruled out, and we think that this is just really severe PMOS that's causing this, there are a few different treatments. So in PMOS, one of the things that we see are the elevated androgens, and I'm hoping they incorporate this other one into the medical criteria, but it's the insulin resistance, and the two are interrelated. And I think it's really important for women to know this because a lot of our treatment for a long time for PMOS was spent trying to lower the androgens. And you can
Yes.
do that with spironolactone. Spironolactone is a great treatment. It is traditionally a blood pressure medication that's a diuretic, but it increases the body's endogenous production of estrogen, which means that extra estrogen drives down the testosterone, and that will improve your scalp hair loss. It works really well for acne that's caused by high testosterone. It also works pretty well for preventing more facial hair from forming or more body hair from forming.
Mm,
To see the regression of that facial and body hair from what the baseline is, that's not always successful because once
mm,
those terminal hairs start to grow, you can't get rid of them with a medication. But that is a really great treatment because that works specifically on decreasing those. Some women will get prescribed birth control. Birth control has the ethinyl estradiol in it, which is really potent at suppressing the testosterone levels. And what estrogen does is it increases the sex hormone binding globulin. So more of the circulating testosterone gets bound up by that, and there's less free that's floating around in your system. In these patients, I'll look at both total and free testosterone to get an idea of how things are playing out because the sex hormone, and I also check the sex hormone binding globulin level because that'll play into how I'm interpreting those labs. So that's another option. Now, where it gets interesting is the insulin resistance piece of it, because metformin has been used off label for decades for treating it.
mm,
And the data has shown that in patients who have insulin resistance and PMOS and elevated testosterone levels, the high insulin makes the testosterone levels worse twofold. It decreases the amount of sex hormone binding globulin that's there. So then there's more free testosterone that's circulating. And then the insulin goes to the level of the ovary and makes the ovary produce more testosterone. So I know,
It's
right? You're like,
cruel. Okay.
it's mean, right? Insulin is not so nice in this scenario. But it just goes to show that if you treat the insulin resistance, you can also help lower those levels.
What this always makes me think of is when people are like, just eat less and move more. It's like, it's not, I know you're rolling your eyes,
Yeah,
everyone that's listening. It's not solving the problem. And it's like, in how many
correct.
ways can we say this? But when you just explain that,
Yep.
that's the little clip I want to play for the person that's still stuck in the calories in, calories out.
Yeah, you have to approach everything from a multifactorial view because it is exceedingly rare that just one thing is playing into whatever your health condition is. Like, sorry, that is not very common at all. Most of the health conditions we treat that are chronic have so many different inputs that are plugging into it. Yeah, so that's generally what I'll do. And metformin is great and all, but GLP-1s, if we can get those approved for PMOS, it will be a freaking game changer.
That would change my life in clinic treating people. Let me just tell
Yes.
you.
Yes.
Yeah.
And I'm hopeful that with this name change from PCOS to PMOS, and we're acknowledging the gravity of these metabolic complications, that'll spur on more research to happen with
Yeah.
GLP-1s in this particular space. So, in this scenario of high testosterone, either due to testosterone producing tumor, which we talked about the first part, or PMOS, this is how I manage that bucket of patients. Yeah.
What about DHT blockers? You hear about this so much in the hair loss industry.
You mean the minoxidils or yeah.
Like finance, even some
Yeah,
doctors will use
finasteride and
finasteride.
yeah.
Yeah.
So I'll say And this is, everybody has a very different experience with these. So when I saw my friend who's a dermatologist, she was like spironolactone and topical Rogaine for you. And so I started that. And the interesting thing is that if you are of South Asian descent, you have a 30% chance of getting increased facial hair when you start using Rogaine
Mm.
to preserve your scalp hair. So it becomes a decision. And that's exactly what happened to me. I was like, what does all this peach fuzz do? I have Cushing's. So I don't have Cushing's. I have minoxidil and it's causing me a problem. And there are some people who say that it works better orally and you don't see that as much, but I did not have a great response to either one. And I have some patients who don't. So at that point, you're left with spironolactone and treating the insulin resistance and trying to do all the other things. And this is where you go into that rabbit hole of what supplement is good for me, what hair serum is good for me. Should I buy a
Yeah.
laser cap or a laser hairband, right? And the
Yeah.
thing is, again, because I believe all of these things are multifactorial, I have tried all of these things. I think the only thing I haven't done is PRP injections for my scalp.
I'm not laughing that you've tried it all, but I'm like, I feel like I'm joining your band camp on this.
Yeah,
I will, I will say like there's few things like right now there's this, oh gosh, you've probably never heard of them, but the brand's called Folly, Folly. I've been talking about it like
yeah.
incessantly. Oh, have you heard of that?
I heard about it on your podcast.
Oh, okay. I was like,
Yeah.
oh my God, you're making me laugh. Anyway, but can I tell you what's funny about it? I think because of how they're doing the different encapsulation stuff, do
Yeah.
you know it's seriously, it keeps me up at night if I don't do it in the morning. I've
Really?
never taken vitamins and things where it had this much of an effect on me. So my
Wow.
conclusion is maybe other things that I've done in the past have not actually been effective because
Okay.
how do you feel so different with something?
Yeah.
But my whole thing is, I think it's really hard for people to understand what is actually
Yeah.
clinically effective as far as dose. And so
Yes.
when I was researching them, I was like, okay, they're on par with
Yeah.
Nutrafol, they're this, they're that, right? Like
Yeah.
I was looking into all that.
Yeah.
With you, do you either did you find anything personally or do you see anything with patients in this whole land of like red light bands and all the things? Do any of them help?
That's a good question. So I'll say for me personally, what I found helped was actually the red light hairband thing. I found one that's like one, I'm not going to sit with a cap on my scalp for 20 minutes. I'm sorry, ain't nobody got time for that. That was just a hard no for me. So I did a lot of research and into looking at it. And there's one, I think it's called Laser Max or something like that, but it's literally, it looks like a headband and
Oh,
it's like 90 seconds on each section of your scalp as you just move like it buzzes and you move the headband back.
okay.
That actually really helped. It's interesting because it has, I think, the same amount or more than the caps of lights per area.
Yeah.
So I think that matters. The other thing is my hair is really dark. So how much that penetrates through that, do I follow the instructions exactly, or did I make up my own regimen? I might do it a little bit more than what they
Well,
recommend, right?
there's some nuance to this.
Yeah,
My sister does red light therapy, like
yeah,
professional machine, that in the clinic.
yeah,
And there's a little bit of nuance. There's what's recommended, but then there's what actually works for the person, whether it be more or
yeah,
less, because some of us are
yeah,
so sensitive, it needs to be less. So
yeah.
I hear you with, I don't know that it's bad to experiment a little bit with this.
Yeah, and it's like I figure as long as I'm like not burning my scalp, it should be okay, right? So there's that. I've tried that. That's been really pretty good. I tried a new supplement recently that I'm halfway through, but it's called Extra A. And so I'm like, I think 45 days into this now because I'm halfway through the second bag. That's how I know. But I like it in that it's easy to take. Like the Nutrafol one, just like it was a lot of
It's a
capsules, and
lot. Oh my
I
gosh.
couldn't. Somebody described it to me as very earth forward, and yeah, and I just
And then
couldn't.
the regurgitate. I mean, like, do you know what I mean? How like that like
Yeah,
taste in your mouth, you're like,
yeah.
ooh, bad choices. Yeah.
Yeah, yeah. That one just didn't really work well for me. And then I think probably 5 or 6 episodes ago, I interviewed this really incredible dermatologist, Dr. Sarah Stearman, on my podcast. And we talked a lot about biotin. And biotin
Yeah.
is a freaking scam, let me tell you.
I
Like,
know.
biotin does not do anything other than mess up your labs, in my opinion. So she told this really interesting story about how the data for biotin came from a study on horses' hooves, where they
Oh
gave
my gosh.
horses biotin to look at subjective thickening of the hooves. And then from that study, decided it was great to recommend to women for hair loss.
But you know what? This is happening right now
Yeah.
with creatine. If you
Hmm.
actually look at the study, It was like, guys, I'm going to be butchering this. I'll put the exact link below, but it was like maybe 20 dementia patients. And then they're like, maybe it didn't get worse, but it's not
Yeah.
like women cognitively getting better or, oh, all this stuff. And
No.
it's subjective. Some of my patients, their brain fog gets better, but there's not amazing data behind creatine, to be
No,
honest.
no,
Yeah.
no. It's great for, I think, muscle, but
Yeah.
the cognition piece of it, it's like we have to be careful.
The way influencers are promoting it, I'm just like, this
Yeah.
is wild that you're making these claims. Yeah.
Well, and I think people also don't realize if they're not hydrating well, it's making your kidney function tests look funny
I
or potentially
know.
even causing some issues. So it's the same thing with the biotin. The biotin will mess up any lab that is done by a technique called radioimmunoassay because the biotin interferes with that. So your thyroid tests will get affected. The two scariest ones I heard, though, one, a gynonc surgeon told me that it messes with the CEA levels, the cancer markers for ovarian cancer. It can falsely lower those. And then I had a cardiologist tell me it messes with the troponin, which is the test they
Oh,
take in the ER to see if you're having a heart attack. Can you imagine somebody who has no changes on EKG, but then their troponins are falsely negative and you miss a heart attack? That to
oh
me is
my gosh.
terrifying.
Because guys, that's a non-ST segment elevated. God,
Yeah.
what's it called? And STEMI, where it's like,
Yeah.
okay, it's very important and we keep people in the hospital. We know something's going on. Wow. That
So
one I didn't know.
yeah, that one freaked me out. And so and like I talk very openly about the heart health history in my family. My mom, my husband are affected. That to me is terrifying. I told them, I was like, check all your supplements, make sure there's no biotin in them, because God forbid you go in, you have to be off of the biotin for a week for it to not interfere with your labs.
But
3 days minimum, but really a week.
what this
Mhm.
brings up for me, though, is that everyone's thinking, oh, AI is going to take over everything. And I'm like, totally. It can look at a lab, it can say what it
Yeah.
thinks should be going on. But then we get down to this, where if someone was in the ER in front of me and they had chest pain and they have a history of high cholesterol, there's a certain
Yeah.
picture where you're like, I
Yeah.
really think something's going on, right? You would then do a stress test before you send them home. You would not, you would say, my spidey sense is up. I'm getting that tingle in the spine.
Yeah.
We got to keep going. So I remember I had a patient in clinic, this is when I was doing primary care, and
Yeah.
she was telling me about the worst headaches of her life. They were bitemporal, so both sides of the temples, guys, worse with chewing, da da da. I'm like, she has, what are we calling it nowadays? Giant cell temporal arteritis or
I think so.
temporal
Yeah.
arteritis?
Yeah.
Yeah. Anyway, so my point is, I was like, this is affected for her. So I got her as far as I did not care that the labs were not elevated because that's classic that the labs are elevated and then you give them
Yeah.
steroids to help preserve vision. We got the biopsy, it was positive. And I was like, if I hadn't kept going, she would have been blind within the next few
Yeah.
weeks, hands down with how it was
Yeah.
happening.
Yeah.
Yeah.
And that's the thing. And I totally agree with you. I'm not worried about AI taking our jobs because they're going to miss stuff like that. Honestly, I think it has the potential to harm people. It actually really scares me when people come in and they're like, I chat GPT'd my symptoms. Let's go toe to toe for line to line and see how accurate you think it is. And I'm like, do we really want to spend your appointment doing this? But okay, if you want to,
If you
yeah.
want to, let's do it.
But yeah, it's not really the best use of our time, but
Wait, so
I'm open.
back to this, the oral thing that you were talking about. So what exactly is it? Is it a capsule or
It's a gummy actually.
oh, a gummy? Okay, cool.
Yes,
Okay.
yeah, because I'm also a child and I can't do pills. Like I love gummy vitamins. Like
I know, me too. I'm obsessed with Groons and Folly. The
yeah,
thing is, I always tell people is if you can't stick with it, I don't care how amazing it is. You
yeah,
have to be able to show up daily to do it.
yeah.
Otherwise, you're not going to do it.
Yeah,
Yeah.
and to be fair to Nutrafol, since I called it out by name before, it actually did help my hair because it's got a ton of other stuff in it. I just couldn't swallow the pills. They made me
Totally.
gaggy, right?
Totally.
So
And
again, it's to your point, the best thing for you is the one that you can tolerate.
that, and I love that you're like, because we called we called them out by name. Different stuff's gonna work for different people, right?
Yeah,
So everyone do what works for you. This is
yeah,
not like going 100% because my clinical scenario, your clinical scenario, it's gonna be very different than the
yeah,
person in front of us. That's why it's
yeah,
so helpful to go see a physician because we can get
yeah.
to the bottom of what's happening for you. Do you use anything like serums or anything like that?
That's a good, yeah. I have not found one that I love, but what I've gone back to recently, and this is my grandmothers did this, my aunts did this, they oiled their hair. And then there's some data around rosemary oil that it may be a DHT blocker.
Yeah.
So I will oil my hair once a week, right? And I feel like that's actually made a difference for the strength of my hair. I think we also, as a society, got super into the no wash washes where we were not cleaning our scalps properly, and that's really bad for your
I
scalp,
never
right?
got
So
into that, but I,
I'm
I
so
remember
glad. I did
I
it for
feel
a
like,
week and I was like, my hair is so oily. It's so nasty. I can't
oh
do
yeah,
this.
because
I gave up.
yeah, if I don't wash my hair daily, it's so fine that it looks so nasty. And I'm like, I'm not trying to look like I didn't wash my hair.
Yeah.
It's a no.
Yeah, so I have a concoction of, I think I bought them all at Trader Joe's, of jojoba oil and argan oil and rosemary oil. And I'm like creating little tinctures in my bathroom and rubbing it into my scalp. But my grandmothers did that with different oils for years. But
Yeah.
I have intentionally put the rosemary in there just to see if it makes a difference. But I think just the act of conditioning your hair, brushing through it, like stimulating your scalp. I bought one of those little silicone things with the little prong things, and I try and like
Yes.
massage it into my scalp very gently, though. I did have a near-death experience with a derma roller because I read this thing about derma rolling your scalp. And so I was like, oh, I'll do it. Did this and then yanked out a chunk of hair. And then I was like, well, that was a stupid plan. But they
Wait, can
have
you
these,
explain what it
yeah.
is to people? Because
So,
everyone might not be in this hair
yeah,
loss
for
world of
like
ours.
some dermatologist is going to listen to this and be like, "Dear God, get this
You know what?
woman,
It's like
keep her safe
contact
from
me.
herself."
We'll have you
Yeah,
on the podcast. Contact me.
exactly. No, but derma rollers have these tiny, fine needles, and the thought is that if you make micro punctures, it
Yes.
increases the vasculature to the scalp and then you grow more hair.
Mm.
I did talk to a friend of mine who's a dermatologist. She's like, use the stamp, not the roller. Right. So there
I've
are
seen
these,
that. They're getting
yeah. So that,
advertised to me like mad.
yeah. And so I am playing with that. Am I consistent with it? No, because it's a little uncomfortable and I'm a baby. So
Again, can we stick with it? All roads lead
I
to
know.
Rome.
Look, your doctors struggle too. Consistency is key. Do as I say, not as I do. Just kidding. But it's hard, especially when it's something that you're wondering whether you have time for, and it just becomes the thing. So I haven't been as consistent with that. The other piece of it is that if you're going to do that, you have to sanitize the heck out of it
Yes.
because then you are setting yourself up for an infection. So I know I have really moved away from that after my initial incident. I did try the stamper. It does work. It doesn't yank out my hair, but again, talk to a dermatologist about whether that's actually useful or not. There are some who say that it will, others that won't. I did experiment with a little bit of Latisse when
Yes.
I had a kind of a bigger patch here in the front that
Mhm.
had really thinned out. It actually did help, but you have to use it consistently. And the thing with Latisse is that it's not made to penetrate the skin on your scalp. So it's only going to be as good as, I don't know. I don't know that it
Yeah.
works.
Yeah.
I've tried
It's
it. When I say I've tried it all, I've tried it.
what I often wonder too is like when if you're using multiple things at the same time, is one contradicting the other? And I'm not
Correct.
talking about, I think the multivitamins and things like that. Okay, that's the substrate, the building block, right? Like
Yeah,
the
yeah,
protein you're
yeah,
eating, having enough B vitamins, all that kind of stuff. But then it's if you're using multiple oral medications and topical medication,
yeah.
and like just at what point does one thing interfere with the other?
And that's my thought, right? Like I don't have time to put all that stuff in my scalp at a regular cadence. Like I'm barely just trying to get the makeup off my face and skincare on, right? Like the scalp is a whole other story.
I was trying this, I forget, oh God, I forget the name of the company.
Yeah,
Everyone was, oh, this is so incredible. Anyway,
yeah.
it left like white dandruffy flakes in my hair. And I was like, can you imagine during the day I'm seeing patients, there's just little flecks, just like
Chunks.
snow in the
Chunks.
hair. I'm like, this will not work. So it's
See,
just
and
interesting.
having darker hair, like that is an absolute no-go for me,
Same.
right? Like
It's
that
like,
is just, yeah, that's my worst nightmare. So I think that there are things you can try, but again, I will say consistency is key. The things I've been consistent with are those hair vitamins and the oiling my hair and the using my little laser hairband that I really like.
yeah.
And they go on and off sale. I've seen them at Nordstrom, I've seen them at Costco, I've seen them all over the
I just
place.
got marketed online like literally
Yeah.
yesterday.
Yeah. Yeah. I mean, there is some data that shows that you see an increase. I think how they count it is like number of follicles per square centimeters or something like that.
Mhm, mhm.
So there are some white papers by these devices that show that there is an increase in that. But again, a white paper is not a randomized controlled trial. So you got
No,
to take it with a grain of salt because it's
no.
not enough patients usually. But I figure it's not harming my scalp and my dermatologist cleared it to try. So
That's what I was gonna say. Sometimes that's better than
yeah.
than nothing that they have
Yeah.
behind them or just talking out of their behind. I think what I like in the beginning, you just talked about such a breadth of different conditions that can be leading to
Hmm.
this, and how if we don't actually treat the disorder, we
Yeah.
know the hair loss will get worse. Can it get better? Who knows? But it's just like we actually have to get to the bottom of that because I don't think that this whole workup's being done for everyone. I
Oh,
know this
it's
for a
not.
fact because it's not happening
It's
for my
not.
patients. And then I'm having to double back. And do you know that and this is, I mean, sometimes I have to write out the labs. I want you to get this done. And let's say they're going to go to the primary care doctor the next day and they'll sometimes be like,
Yeah.
well, is there anything else I should throw on? And I'm like, okay, so here's what I want. I'm like, but then I also write the reason so that that doctor doesn't want to
Yes.
punch me. And I'm like,
Yeah.
hey, it's because we're worried about da da da, and here's what I would do with it. And then
Yeah.
they're always okay and they order it. But if
Yeah.
you don't explain it, they
Oh,
think you're being a backseat
yeah.
driver.
Yeah, absolutely. And sometimes what I'll do, like I created a panel of labs for hair loss in my EMR. I'll just be like, you know what, I'm going to order this, take the sheet. It has the diagnosis codes and the labs on there. So if your primary care doesn't feel comfortable ordering, you have it, you can just go get it and we'll talk about it because it is hard to have that conversation sometimes.
I would love if you know how your course coming up here
Yeah.
with all the
Mhm.
menopause and all that stuff. I would love if you
Yeah.
would throw that in there because I feel like
Yeah.
both clinicians and patients alike that are going to be doing your course, like
Yeah.
oh my gosh, would that be valuable to just
It's like
know actually what's correct.
you just gave me a whole new module.
I was like, please make it the hair loss module.
Yes. Yes. Okay. So yes, I will add that in there for you.
I know it's a very diverse topic. Do you think there's anything that we didn't talk about that's important to know in this area?
Ooh, I think, let's see here. We talked about all the different endocrine conditions. We talked about nutritionally, like what you need to be doing. I think stress management and sleep is a
Yes.
big one. I feel like a broken record saying it over and over and over again because I say it about every condition that
Yeah,
afflicts you. If you're not controlling your stress and you're not controlling your sleep, none of these things are going to get better,
I
right?
know.
So it's really hard to be able to make a functional difference if you're not doing that. I would say that's my biggest thing. What I would recommend is making sure that you're focused on that. The other thing is that if I cannot find anything medical, and even if I do, you should still go see a dermatologist. There
Yes.
are
Preach.
autoimmune scalp conditions that no matter what I do, no matter what supplement you try or what
Right.
laser hair band you use, it is not going to get better unless you treat the root cause of that.
That and the time that we waste. I think
Yes.
that's the thing that people are missing,
Yeah.
right? That let's say you're going to see if that supplement works. Okay, you're going to give it a year and miss something else during that time. That is
Yeah.
really what we're wanting to avoid as
Yeah.
well.
And my derm colleagues are happy to see patients because they get and I was listening to your last podcast about going in and she did a really thorough evaluation of your scalp. That's kind of what happened when my derm friend called me out and she took pictures of my scalp and I was like, "How dare you?
I know when
How
she,
dare you show me that? I came for a rash."
she's like, we're going to document the beginning. And I was like, oh.
I know. It hurt my soul a little, but it was very necessary so I could actually see if things were working, right? So
Yeah,
that I think is, don't sleep on a dermatology evaluation. Our derm colleagues are amazing at what they do, and it's really important for people to get that level of expertise when they are struggling with hair loss that's that severe.
yeah.
We want to blame it on so many things. I've heard stories. One of my patients a few weeks ago was like, I stopped my statin because it's causing my hair loss. And I
Yes,
was
I've
like,
heard this. I've heard this with meds
please
too.
don't do that. Like, so I sent them to derm. I was like, please don't do that. You're going to mess up your heart to save your hair.
I know.
Yeah.
Yeah,
So,
yeah. But witnessed to anyone that's going through this, it is a hard experience. We both can speak to this. I think there are answers. There are things that can be investigated,
yeah.
but you do have to a little bit take the bull by the horns here
Yeah.
because one person might not have all the answers for you. And I think that's a hard thing. You think, well, I went to the primary care doctor. Just knowing there are limitations to who you're seeing, even me now, there's going to be things I don't know. You need to make sure that you get the full whoever you think needs to see you, and probably dermatology is one of them.
Yeah.
So,
Absolutely.
yeah.
Absolutely. I couldn't have said it better.
Thank you so much for coming on again today. I always have the best
Pleasure.
conversations. And thank you for always sharing so openly with what's going on with you as well. Because I feel like we can just sit in these ivory towers and be talking
Yeah.
about knowledge. But if we're not sharing some of the actual human experience as well, I find it's just really hard to connect to the
Well,
information. How can people find out more about you? Like, how can they follow you? What's your website, social, and podcast, just so people
yeah.
can follow you with all the things?
Yeah. Well, first, thank you for saying that. And thank you for having me. I know you and I are very similar in philosophy that you have to share those things because then it's just somebody talking at you. It's not
Totally.
lived experience. And
Totally.
my hair loss journey and my crazy stories of my mom busting into my doctor's appointment and being worried if I'll get married. By the way, I am, and I have a kid. So
It
fulfilled
all
that
worked
duty.
out.
It all worked out. But they're so, if we're not sharing those real stories, life is too hard anyways. We can't be
Yes,
so serious about, so precious about all of these things.
totally.
People can find me on my socials at Dr. Patil-Sisodia. That's the same on Instagram and TikTok. My podcast is called Clearly Hormonal. You can find it on anywhere that you stream your podcast. And my clinic, if you're in Washington State or California, because I have a license there and I do some telehealth, my practice is called Eastside Menopause and Metabolism. It's located in Redmond, Washington, and you can find that at my website, eastsidemmM.com. And thank
Love
you
it.
again for having me. This was
Yes.
so much fun.
We're going to link to everything underneath the show notes underneath where you're listening, or you go to rentiaclinic.com. You can click on podcast and we'll have all of this. Thank you again. That marks the end of today's episode. But if you're newer to the podcast, I want to tell you about something that we have, and it's a free podcast roadmap. So this is perfect for any of you that are listening where you want to be directed to very specific episodes. So let's say that you are just starting out and you want to know, what should I do right when I start on the medications? Or you're experiencing certain side effects on the GLP-1s, or you want to know what to do if you're in a plateau, or if emotional eating is taking over, or if hunger levels are high. So we have many different categories of episodes that we've talked about, because there's a lot at this point. So if you want to be able to navigate that very easily, we have it broken down by category, and also the episodes that are there, and we hyperlink to everything. So you can just click on it and find the episode, easy peasy. If you want that, you can go to rentiaclinic.com/podcast roadmap. We'll have it linked right here underneath the show notes where you're listening. And you can go ahead and get that free resource so that it makes it easy for you to navigate, because I know that it's really hard when someone has an established podcast. I am such a podcast fiend. I'm listening to podcasts all day long. And when I find one that I love, but there's a lot that are out there, I am so lost. So I hope that you enjoy this free podcast roadmap. Again, the link to get to that is going to be rentiaclinic.com/podcast roadmap. I hope this is helpful, and let me know if you have any questions.